Hello, everyone, and welcome to Module 3. Now, in Module 3, we're going to be taking a more structural and functional approach to aging. So far in the course, we've really been zooming in, talking about the theories. We've talked about hormones and the immune system, as well as some of the more biological components, so the cellular organelles and cellular processes that are involved. We're really going to step back in this module and look at aging as far as the physical eyes can see. So what are some of the structural and functional changes that happen over time to the major body systems? And so we'll start with an overview of kind of the general change that the body makes, and this is the idea of frailty. And so by the end of this presentation, we should be able to describe frailty and the physical changes that are associated with aging. We should have an understanding of the various aspects or components of frailty, and then we should be able to discuss the interventions that are associated as far as overcoming some of those aspects of frailty. Now, frailty is the general overall collective decline in all physical body systems that happen with time. It's primarily related to the loss of function of skeletal muscles and the skeletal system, so the bones, joints, ligaments. And this is what also places elderly individuals at an increased risk for things like falls, being dependent of others, and the need for long-term care, or being located in a facility where they need that type of care, as well as mortality. And so these types of changes are a normal part of the aging process. We want to appreciate that while there may be coexisting medical disorders, some of the changes that we're going to discuss as a part of frailty are just the natural progression of age, and there aren't any diseases as such that are linked to frailty. This is a general vulnerable state for the body, and any type of minor stress or minor injury, even the slightest fall, can result in permanent, long-term consequences or even death. Frailty can be seen in persons during illness as well. So again, we want to delineate the difference between pathology, illness, chronic disorders, and frailty, but we also want to understand that they can kind of coexist in the same, at the same time. Now, I'm sure we know what frailty looks like to the physical eye. I'm sure we've got grandparents and great-grandparents or just elderly individuals that we know of. And so we know kind of the general signs, but let's kind of expand on those here a bit. So there's a general loss of independence, and a loss of independence in terms of daily activities. There's a decrease in physical activity or physical function. There's poor nutrition and body status. So this overall loss of weight, along with the muscular changes that we see, which are basically atrophy and sarcopenia, where the muscles get really small. So not only is there a loss of body fat, but there's also the decrease in muscle size and muscle mass as well. There's a decline in multiple systems, so the endocrine system, reproductive system, the kidneys. So there's just this multi-system dysfunction. There's an intolerance to any type of stress. So elderly individuals have a lower threshold as far as being able to tolerate physical injury, things like surgeries, toxins, even emotional stress can be a little bit more impactful with age. And this is a part of the dysfunction that's seen with frailty. There's a decline in cognitive ability, memories, and even the ability to reason well. There's usually poor dentition in some instances. There's a slowing of the gait. So there's this shuffling gait sometimes associated, sometimes just a slowing down of the gait, which is associated again with the decline in muscle mass, along with the weakening of the skeletal system. So again, the bones, joints, tendons, etc. There's a decline in overall hygiene, which is usually associated with the behavioral component of frailty. And I'll talk about the behavioral aspect of frailty, but there's not a decline in hygiene because of intention, but there's just the kind of the lack of care that's paid to that, that aspect as a part of the behavioral dysfunction that's seen with aging. And again, this overall decline in physical strength because of the loss of muscle mass and a decrease in energy because of the increased energetic demand, as well as the decrease in things like oxygenation and circulation because of changes that happen to the respiratory system and vasculature. Now, as we mentioned earlier, frailty implies this multi-system dysfunction. And so many systems are affected. There's the cardiovascular system, the heart, the vasculature, they change in structure and also change in function as a consequence. There's the respiratory system, where we see this large barrel-shaped chest. We sometimes see weakening of the respiratory muscles, and we also sometimes see this calcification of the thoracic cage and this hunching of the back sometimes. And so these are some of the respiratory components to frailty. We see nervous system changes, central nervous system, peripheral nervous system, the slowing down of the nervous system, as well as the behavioral component. So again, the loss of cognitive ability or dysfunction in cognitive ability. We've got neurodegenerative symptoms coming in, so loss of memory, etc. And then changes to the musculoskeletal system, again, overall muscle decline, skeletal system dysfunction, and then the kidneys and metabolic systems as well. So this kind of multi-systemic decline in function is what we call frailty. Now, frailty may be caused by or associated with normal aging, as well as disuse. So poor lifestyle choices, smoking, injury. Maybe if you are a bodybuilder, you've got extremely weak joints. Maybe if you are a runner, you also have poor joints. So just kind of poor lifestyle choices may be a contributing factor to how fast frailty comes about, or how frailty progresses or declines more rapidly with age. And then frailty may also be caused by actual disease process. So while we want to, again, separate things like malignancy and cancer and disorders from frailty, if there are those disorders, then frailty may be augmented or sped up in the way that certain body systems decline with function. Now, there are four main dimensions or components or aspects of frailty. We've got the physical decline. So this is obvious, decline in physical structure and function. So things like walking, talking, lifting, balance, the ability to hear and see. We've got nutritional frailty, which is really associated with things like oral hygiene. The loss of dentition may affect nutritional status and the ability to eat certain types of foods, etc. There's cognitive frailty, which is the decline in mental abilities. So again, things like being able to reason well, being able to make good decisions, memory formation, etc. And then there's the psychosocial aspect of frailty as well. So this is the ability to provide for oneself, to have a means of income, the physical dependency on others as well. And so this is more the psychosocial aspect, where some patients may physically be well, but not well enough to work or to, run errands for themselves and take care of themselves or their household. And so that ties into frailty as well. So let's expand on each of those dimensions of frailty here. So the first one is physical frailty, and this is pretty much obvious physical decline in the body structures. So loss of muscle mass, loss of physical strength, the ability to lift or to hold things, to grip things, loss of balance, and vestibular function, a decrease in bone density as we see increased demineralization of the bone, leading to weakened porous bones, and the overall instability of joints and muscles, along with bones, creates the overall increase in risk for falls. There's also a decrease in the fiber diameter, so the size of muscle fibers, the cross-sectional area of muscle is decreased. And that also affects the force generating capacity of these muscles. So with the smaller muscles come a decrease in the actual force that these muscles can generate, and that leads to weakness. Now, it's thought that the number of individual fibers decreases, which is irreversible pretty much, and then the size of those fibers also decrease, which to some degree may be reversible. And so on this image here on the right, we can compare the cross-sectional diameter of the quads and the hamstring muscles in a 21-year-old versus that same cross-sectional diameter of those muscles in a 63-year-old. And we can see that most of the skeletal muscle mass is replaced by fat and fatty tissue. And that is a change that we see that not only creates this weakening of the body overall, but the loss of strength in terms of being able to move and lift things and run, etc., the way we once could. Now, the nutritional dimension of frailty is usually as a secondary result to some of the other body system or body structure changes. So there's a loss of appetite that is associated with age naturally. There's also a decrease in the senses, so decrease in the efficiency of taste buds, a decrease in the hearing ability, sight and smell ability. And so this leads to an overall decline in the interest in food, right? Because you can't smell food, taste food as easily. And so there's an overall loss of appetite because of those sensory changes. There's also a decline in oral hygiene, which is caused by poor dentition. And this usually leads to a semi-solid or liquid diet. And so there's some association with nutritional ability or nutritional demands when the diet becomes liquid or semi-solid. There's also usually dysfunction as far as digestion. So there's usually acid reflux or the inability to digest large meals or acidic meals. And so there's usually issues with what types of foods elderly individuals can tolerate safely without having indigestion, etc. And then there's also the economic factor here as well. So as I mentioned earlier, kind of tying into the psychosocial dimension, there's the inability to provide, to acquire means usually, and this can affect the type of food, the quality of food that elderly individuals have access to. And then, oops, excuse me. And then the final point here is that the physical dysfunction may affect the individual's physical ability to prepare their own meals and to feed themselves adequately. Now, the cognitive dimension of frailty is probably one that we're all the most familiar with outside of the physical dimension. And so this is where we have dysfunction in cognitive abilities and mental functioning. So the loss of memory, both short-term and long-term memory, more so short-term, because elderly individuals have this really, unless there's Alzheimer's or Parkinson's, they have this really protected long-term memory. So they can usually remember things from long ago. They usually remember aspects of their own childhood or their early adulthood, but then it's the short-term memory, like what they had for breakfast or who's the president, that they usually have trouble remembering. There's also an inability to complete daily activities, things like showering, dressing, cooking, cleaning, running errands, paying bills and whatnot. Driving is another dimension that, or another daily function that's kind of associated with this dimension. There's a loss of coordination. So the ability to do multiple things at a time, as well as the loss of mental clarity, the ability to voice their opinions. Elderly individuals, this is something we probably know from experience with our own grandparents or parents. They usually have this frustration with their inability to voice their opinions clearly the way that they once could. And so that mental clarity kind of slowly declines with age. And that mental frustration as there's a loss in the ability to express certain aspects or ideas clearly. Now, the psychosocial aspect of frailty is one that's often overlooked. This is really having to do with the overall sense of well-being, especially the mental state of elderly individuals. There's an increase in vulnerability to mental illness, which is associated with depression, anxiety, And some older individuals have a hard time just coping with all that's happening as a part of the aging process. So their decline in general well-being, their decline in their own ability to provide for themselves and to be independent. There's also a hard time coping with some of the chronic illnesses that are associated with aging, as well as probably detachment from the world or from their children, grandchildren. And so those types of realizations can have some consequences mentally on individuals as they age. There's also a social vulnerability where, again, there's this decrease in independence, again, not able to provide an income usually, and may or may not be less educated or financially stable when compared to other members of the family. So these types of factors are often overlooked in elderly individuals, especially as they lose their independence. And so we want to bear in mind that there's a mental component to aging too. And so that's really important to take into consideration as we think about frailty and the overall individual. So finally here, we'll talk about some of the interventions that we can bear in mind as we think about frailty and as we take into consideration elderly individuals and how to best care for them. I'm sure many of you who work in nursing homes will attest to some of these interventions, or just having personal experiences, again, with your own parents or grandparents, and how some of these factors and strategies can be helpful when we have to care for the elderly and when we think about frailty. So the resistance to exercise and strength training, or the resistance exercise, sorry, not resistance to, those types of activities can help with the decline in muscle mass. So it's also thought that a part of why the muscle fiber decreases is because of disuse. So as we get older, or elderly individuals decline in their strength, their ability to actually do physical or strenuous activities, they then have a decrease in the incidence of those types of activities. So basically, as you feel less safe exercising or walking, you stop exercising or stop walking or stop training. And so that disuse also contributes to the decrease in muscle fiber size. So keeping up with that type of exercise, keeping up with that type of strength training and that type of therapy is what can keep the muscle fiber at a size that's large enough to provide some degree of strength and kind of decrease the amount of dysfunction that's seen with aging. Flexibility training is also encouraged, so things like yoga and going to the beach to help improve balance and avoid falls. Weightlifting exercise is important to maintain bone mineral density, especially in women, because women have that increase in osteoporosis because of hormone balances or hormone imbalances that happen even before elderlyhood or before menopause. Self-mentoring tools, therapeutic games and activities, things like puzzles, knitting, gardening, maybe reading or watching TV shows, as well as other types of engaging activities, phone conversations, video interactions, again, watching TV, listening to the radio. And then one of the most influential factors on longevity is really having friends and family, especially pets or just loved ones in general around. This is one of the most important factors as it relates to the psychosocial and cognitive ability or the ability to cope with aging from those perspectives. So having just a support system around these individuals of people who've known them, who they can relate, lifetime stories with, as well as pets or spouses is one way that we can kind of intervene and slow down the rate of frailty. So now that we've kind of discussed the topic here, I encourage you to go ahead and extend this conversation into the discussion this week. So you're going to use an image to describe your impression of frailty. There are no rules to what type of image, but you should be able to explain or rationalize why you chose the image that you did. Also talk about what lifestyle changes might delay or slow down frailty. Again, you can draw on your own examples. You can draw on your own experiences. Again, if you're a CNA or you happen to work in a nursing home, that'll be a great experience that you can draw from. And then finally, describe how the dimensions of frailty may differ in terms of their obviousness. So which ones may be overlooked, which ones may be more obvious, which ones may friends and family and caretakers be more sensitive to versus which one may not get as much consideration as it probably should.